It's 24 minutes past 7. A number of doctors will be investigated by the General Medical Council after the BBC discovered that some were inappropriately prescribing antibiotics on internet clinics.
Yes, one issued the same journalist 3 prescriptions in the space of 24 hours. Dr. Faye Kirkland is a GP and has also reported on this story for the BBC. Morning to you.
Good morning.
So just explain to us how this might happen, how one person can get the same prescription so many times.
Well, the way these sites work is patients log on and they answer sort of a simple questionnaire. So they don't speak to, they don't have a Skype consultation with a doctor, they just fill in an online form. And that then is sent to a doctor and they look at the answers and then they decide whether to prescribe an antibiotic based on that simple questionnaire. So these are not your NHS GPs, they don't have access to your notes. So we were able to fill in a form and then obviously the person didn't realise that we were the same individual, essentially.
And we should stress, these sites are perfectly legal. They're absolutely supposed to work properly, supposed to be a helpful addition to the NHS to take pressure, I guess, away from GPs.
Well, these are actually all private online clinics, so they're actually not part of the NHS. So people are going on these sites and buying antibiotics, but that's not normally part of what that's different to what the NHS is doing. And patients are saying that they're using them because that they find them convenient, or they're not able to access their GP or their dental services. These sites, or doctors behind these sites, are prescribing for a whole range of conditions, from sort of chest infections to ear infections to dental infections.
From what we've heard about antibiotics and the importance of not taking them too much and diseases, viruses becoming immune to them, you would imagine now it's more important than ever that you don't have an antibiotic unless you really need it.
Absolutely. And when we had the sites looked at by leading experts in bacteria, so leading consultant microbiologists, there were real concerns about the questions being asked. So, for example, we went on and bought antibiotics for ear pain, but that could have just been a virus and the person might not have actually needed those antibiotics. So the concerns about some of the sites not asking the right questions, so that patients are being misdiagnosed, giving antibiotics when they don't need them. Exactly as you say, at the moment we're so concerned about antimicrobial resistance that there's concerns that sites operating in this way are potentially exacerbating that.
What can the General Medical Council do about this?
Well, we showed all our findings to the General Medical Council and they're now going to investigate the individual doctors operating behind these sites, because the General Medical Council says you should be getting the same care, be it online or face-to-face. And doctors really need to decide if they are prescribing online, whether they're sort of hindered by not having access to the patient's notes, by not being able to examine them. We also showed our findings to the Care Quality Commission, who regulate the services, and they were very thankful actually for our investigation, and they are currently looking at the way that they regulate and inspect these online services, and they're going to use our investigation in the way that they change the way that they look at these online pharmacies.
How difficult as a doctor is it to diagnose somebody just from a form, from a piece of paper?
I think it's incredibly difficult. I see patients in my clinic who come in saying, "Oh, doctor, I've got an ear infection, I've got ear pain," and when you actually examine them, it's actually a dental infection or something completely different. So I think for me, it's incredibly difficult to get any kind of accurate diagnosis in this way.
And broadening it out a little bit away from antibiotics, are these sites open to abuse? If someone has a problem with painkillers or something like that?
Yeah, completely. The doctor doesn't have access to the patient's own medical records, so potentially you have to tick a box on a lot of the sites saying that that you are telling the truth, but completely, potentially people could be not filling in the correct information. But we showed all our findings as well to the British Medical Association, and now they're saying for the first time where patients aren't being examined, they're not being investigated, they do not think antibiotics should be given at all online in this way, because there's so much concerns not only for the individual but for the whole population. And the British Dental Association said that sites that are prescribing for dental infections without seeing patients, they're actually saying that's indefensible.
I'm sure some people might say that one of the reasons they go to online sites is because they can't get an appointment with their doctor.
As you said, yeah.
Absolutely.
Dr. Faye Kirkland, thank you very much indeed.